We are now entering into the IVF lab, the sanctum sanctorum of this hospital. Now, you heard an alarm ringing when I entered the door. So the alarm rings and this is connected to a central alarm system, and anybody who enters the lab, it's always recorded. So now we have the IVF theatre, we have an anesthetic apparatus, the patient bed, and most important of all, we have the ultrasound machine. So the ultrasound machine is very important because and this is a machine which is exclusive for this area. We use this only for egg collections and embryo transfers. This is called a vacuum pump, and the vacuum pump is connected to a set which in turn is connected to the aspiration needle, and the aspiration needle actually creates a negative pressure inside the follicle, and this is the vacuum pump which creates a negative pressure, and it sucks down the follicular fluid into the tube. The tubes are then kept in this test tube warmer. Nothing in this lab is kept outside. Once again, it is a closed space. If you open it, then all the tubes in the warmer are kept into this digiblock, and this digiblock once again maintains temperature at 37 degrees centigrade. So all the time the follicular fluid is at 37 degrees centigrade. Now only when I close this door will now this is an alarm going off, so the outer door is now locked. Automatically it's locked. Nobody can enter the lab till I close this door. So once again, now this door opens only when that side is closed. The embryologist then picks up the tubes from there and then he goes to the microscope. Now the microscope is a heated area. The entire thing, this is a laminar airflow which gives pure air and keeps pure air all the time, and the microscope, we use it to look at the eggs. So this is the HEPA filter. It's actually the first filtering system which filters all the abnormalities, and this is actually incorporated in the air conditioning system. Now the second level of filtering is called the Coda filter. The space is going to be there, and the Coda filter absorbs the rest of the impurities. Now once again, the third filter is the charcoal filter which is fitted in the incubator. So this is the charcoal filter which is actually fitted in, and the humidity inside is maintained with this humidifier, so that all the things are maintained in perfect condition. So very important, this is one of the top end incubators, and it has 10 chambers, and each chamber can accommodate 2 patients' embryos. So in toto, we can accommodate 20 patients' embryos in this incubator, and when you open, make sure that only 2 patients' embryos are exposed and all the others are still kept in condition. Now you would note that all these settings are actually for each system. The Hera cell, this is another type of incubator, but we use this, it can be used for embryos as well, but we use it mainly to incubate our catheters, our tubes and the culture media when we want to equilibrate it overnight. So this incubator is, when you open it, the entire system is opened. So therefore, we do not use it for purposes of we do not use it for purposes of keeping the embryos. We use it only to incubate the culture media and the disposables. This is called an ICSI microscope, and you see sperm at 400 magnification and you select the top class sperm. Now with this system, this is what is normally used. Now there is a software introduced in this which is called IMSI. So in IMSI, you see the sperm at 7000 magnification and you select the top class sperm. It's a computer generated image and selection of sperm. So you select the top class sperm. Naturally, when you select a top class sperm, you get a top class embryo. And once the embryo is selected, once the sperm is selected, it's injected into the egg and the embryos are kept into the incubators for further development. This is the embryoscope, and this embryoscope has chambers for 6 patients, and the embryos are actually loaded onto each dish, and once the injection is done, the embryos are kept in the embryoscope. This is the screen which shows one patient's embryos. So she has 12 embryos and we will now see each embryo separately to appreciate the growth of the embryo. These are the embryos, they are all in different stages of division, as you would see. Now we will move on to one separate embryo so that you can see the development from the 2PN stage up to the blastocyst stage. So here you see the egg, the sperm has been injected, and here you see the formation of the 2 pronuclei. So this is the 2PN stage, and the next is it goes through syngamy, and now it becomes a 2-cell embryo. This embryo now divides and it becomes a 4-cell embryo, and it's now going to become an 8-cell embryo. This is the sperm preparation. It's done with a spermifuge, which has several programs to actually suit the patient, and the programs are set and the sperms are actually washed and taken. And once the sperms are selected, then you look under the microscope, make sure that everything is okay, and then you actually take it into the main lab for injecting into the egg. Now another thing which we must know about this lab, this is the cryologic freezing system. So we need sperms to be frozen here, because each patient in this lab has a frozen backup sample, because sometimes they cannot produce a sample on demand on that day. So we have this cryologic system, and all patients have a backup sample, and it's one of the highest systems to freeze sperms, and we keep it here. And once the sperms are frozen, they are actually put into this can, into this tank, and the tank actually is used to freeze only sperms. So this is a sperm room, a pure sperm area, where you look at sperms, you actually identify, take them for injecting, and then here you freeze, put it into the freezer. So like the previous room was a totally sperm area, this is a totally egg and embryo area, and it's totally cut off from the rest of the lab. So every compartment is an airtight compartment, and unless you close, the other one doesn't open. Now here, once we use this to examine the embryos and the eggs, and the freezing system is here, and the liquid nitrogen tanks are here, and then you just dip it into the liquid nitrogen tanks, and once it's prepared, dip it into the liquid nitrogen tank, and then you keep it inside this area. Now this has several patients' embryos, and they are all labeled. Their number is there, their label is there, all information is there in that label, and you can easily identify in which compartment any embryo, any patient's embryos are. So it's an absolutely foolproof system to actually freeze your eggs and embryos. There are different ways of sperm selection too. One is the normal sperm selection which we do under the microscope, but there is a technology called microfluidics, and the microfluidics also helps to select the sperms by a simple membrane separation without any revolutions that you normally put it in a centrifuge and you do that. So the sperm is not subjected to all those rotations. There's also a magnetic sorting of the sperms. So these are all different ways to identify the top class sperms. And our aim is you want a healthy egg, you want a healthy sperm, you want a top class sperm, and you want to create the best embryo and the best baby that you can create, and improve pregnancy rates. The pregnancy rates in 1980 started at 8%, and today our pregnancy rates are close to 80% to 85% in select patients. So all this has been because of the tremendous technology advances which have happened over the last few years. Anything which comes into this lab is made absolutely sterile. We clean it before it enters, and it all goes into the cupboard here. So the things inside are also kept absolutely clean. And who maintains the lab? This is my chief embryologist, Mr. Radhakrishnan. He is actually doing his PhD, and he's one of the top class embryologists I can speak of. Thank you very much.